Thank you for joining me on a Save My Thyroid podcast, where I help people save their thyroid and regain their health. My name is Dr. Eric Osansky, and if you have hyperthyroidism, including Graves' disease or toxic multinodular goiter, then you will especially benefit from these episodes. If you have Hashimoto's thyroiditis, you also need to save your thyroid, and therefore you'll also find many of the episodes to be valuable. You're about to listen to another Save My Thyroid health audit, as I will spend approximately 25 minutes chatting with someone who has a thyroid or autoimmune thyroid condition and give them actual advice to help them improve their health. In this Save My Thyroid audit, I will speak with someone who has Graves' disease who was fired by her endocrinologist for not following their recommendations. Her name is Paula, and while she is still working on decreasing her Graves' disease antibodies, she has been able to successfully manage her hyperthyroid symptoms naturally with herbs and therefore avoid taking methimazole. Just a reminder that this audit isn't exactly the same as a comprehensive consultation I do with a patient, as prior to doing an audit, I have the person fill out a brief application, and it's fine if they send a few basic blood tests, whereas with a patient consultation, I'll have them fill out a comprehensive health history and other forms, and they usually will also send a decent amount of labs for me to review. And of course, the patient consultation is a lot longer, but either way, I'm confident that you'll find this conversation to be valuable. Also, if you would like to apply to do an audit with me, you could do so by visiting savemythyroid.com/audit. As usual, make sure you listen to the post-episode chat after the outro music, as I'll expand on being fired by your endocrinologist, avoiding methimazole, having a low TSH, having elevated TSH receptor antibodies, gaining weight with Graves' disease, anxiety in Graves' disease, and digestive enzymes. And you can access the show notes by visiting savemythyroid.com/188. Here's my conversation with Paula.
Welcome to the Save My Thyroid podcast, hosted by Dr. Eric Osansky. To stay up to date on the latest thyroid health-related topics, make sure to subscribe on your podcast player. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. The following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking with your doctor. Now let's head to the show.
So welcome to another Save My Thyroid audit. I am very excited to chat with Paula here, who is joining us from Sarasota, Florida. Thank you so much for being here, Paula.
Thank you for having me, Dr. Eric.
I think this is going to be a great conversation. Your background as far as health condition, Graves' disease. Before we get into the conversation, can you let everyone listening know how you found me?
By chance, it was so lucky. I actually was driving to the farmer's market one morning and I was listening to NPR and I was listening to the People's Pharmacy. And I had been struggling with this diagnosis and you came on and I was like, wait a minute. I came home and I pulled up the podcast and re-listened to it. And I wrote down your name. I wrote down your book and I bought the book the same day. I was so excited because you were the first person or the book or anything that had a natural pathway. And the fact that, put yourself into remission since 2009, like I was hanging on to that because I thought, you did it. I can do it. I'm just going to buy his book and follow his book. So it was just by happenstance. I was so lucky to hear that podcast on NPR.
All right, wonderful. Yeah, there's not a lot out there when it comes to hyperthyroidism, Graves, a lot more when it comes to Hashimoto's and hypothyroidism. So I'm glad you listened to the podcast and you get interviewed. And then, yeah, that's great that you got the book. And just based on the information you filled out prior to us getting together, sounds like you gotten some good results on your own. And so you were diagnosed with Graves in December of 2023, also had nodules as well. And then first, actually, you were told you had hypothyroidism, right? And then you were told to take Thyroid before you were told that you had hyperthyroidism and was recommended to take methimazole, correct?
Correct. Okay. When I went to see the endocrinologist, based on my symptoms, like I gained weight overnight, like 20 pounds, and I was tired. I just thought it was all menopause. So I had no idea I had a thyroid issue. And then she said to me, I didn't have nodules, that I had an inflamed thyroid. And I probably, based on what I told her, I had hypothyroid. And then 4 days, 5 days later, her assistant called me and told me I had Graves' disease and there was a prescription for methimazole waiting for me at the pharmacy. That was it. And so, of course, I lost my mind at that point. And I had her call me back, and she and I got in a big fight because I said I had enough time to Google, which Dr. Google is a bad thing. I had enough time to go to Dr. Google and learn about methimazole and the side effects. And I don't take medications. I'm very active. I eat organic. So I was like, I'm not taking this drug. So she went from prescribing me 10 milligrams twice a day to 5 milligrams twice a day in this one phone call to 5 milligrams every other day. And so I thought, what is going on? So I made the decision this was the beginning of December, to wait until January 1st to take methimazole. That was my date. And then in between that, I heard your podcast. I bought your book, which is highlighted and torn apart. I made the decision that January 1st, because of your book, I was going to go on the AIP diet, the autoimmune protocol diet, and I was going to start with bugleweed and motherwort. And that was my plan, which is a hard thing to do when you have a doctor who is so mad at you because you're not following her protocol. And she kept calling me. She continued to call me to see if I started the medication. And I kept putting her off, and I kept saying, oh, I'm getting a second opinion. And then lo and behold, one day, my husband says to me, you got a certified letter from your endocrinologist. Sure enough, she fired me because she didn't want to even talk to me about another pathway to healing. And I did get a second opinion. I went to the Mayo Clinic to appease my husband, and he said the same thing. He said, it's an autoimmune disease, but you should go on methimazole. And I said, but does that help the autoimmune component? He said, not at all. And I said, isn't there like a 50% chance it's going to work and a 50% chance it's not going to work? He said, yes. And so I said, is there any other way? And at that time I was taking bugleweed. I didn't tell him because I knew he would yell at me. He said, no, that is the only way. So I was extremely frustrated. But I continued on. And then I bought your other book, your thyroid healing book, that came out. And so I did the AIP protocol for 4 months, really strict. And then since then, I've been doing like your diet number 2, because occasionally I have eggs, occasionally I have nuts like Brazil nuts and walnuts. So I've kind of been doing that since then. It's really hard when you have a doctor and then you get certified. Like my husband and my kids, they're like, Mom, are you crazy? And I said, you know what? This doctor, he put himself into remission since 2009. This is how he did it. I'm going to give this a try. If it doesn't work, I promise I'll go on the meds. And so fast forward, it's September and my numbers, my free T4 and free T3 are normal. Like all of my thyroid antibodies are normal. My TRAB is still suppressed, but it is moving in the right direction.
You mean TSH is the thyroid stimulating hormone?
TSH is suppressed and my TRAB is still high. That's how.
Okay. So it is still, okay. So
it's still high, but it came down from like 2.51 to 2.07. So like, I believe that my numbers are moving in the right direction and I feel great, like better than I have in a long time. So.
Yeah. No, that is awesome. And I mean, just for those listening, there is a time and place for anti-thyroid medication. So if someone's taking the methimazole or PTU, again, it's like I didn't take the medication. I took the herbs, bugleweed, and motherwort as well. And a lot of my patients do, but I do work with patients that take the anti-thyroid medication while addressing the cause of the problem. That's the thing. Most endocrinologists will say, just take the methimazole and that's it. That's the answer for 18 months to 24 months. Take that and let's see if you'll miraculously get into remission. And if you do, then most people eventually relapse because they didn't get the cause of the problem addressed. But so it was good that you were able to avoid the medication and you also took the bugleweed, the motherwort, and your antibodies still a little bit high, but heading in the right direction. Your thyroid hormones, T3, T4, looking good and feeling good, which is important. Feeling better is a good thing. So that's wonderful. You mentioned initially you got my first book, but then the hyperthyroid healing diet book. And then you were following more of a level 2 diet, which is a kind of a modified paleo diet. What symptoms are you still experiencing? I think anxiety you put down is like maybe.
Anxiety is the biggest thing. That's the biggest thing. I've never had heart palpitations. I never had a racing, like your symptoms. What happened to you did not happen. It did not lose a ton of weight. I gained a ton of weight. So it was the complete opposite of Graves' disease symptoms, which I thought was interesting. Another reason why I didn't think I had Graves' disease, I didn't add any of the textbook symptoms. I just had the blood work. So now my biggest symptom is anxiety, trying to keep myself calm and not anxious. And, I meditate every morning before the day starts. I do the breathing exercises and I meditate, but still, that's the thing that gets me the most. And knowing that I'm doing the right thing. And I think I stress about that. Am I on the right path? Is this going to work? But when I got this blood work back about 2 weeks ago, it was such a reassuring thing to see. So that really helped me tremendously to know that I'm on the right path. Because, when you have everybody else telling you that you're not on the right path, I went to my general and she yelled at me because I'm not on methimazole. So when you have all these doctors telling you you're not doing the right thing, even though my blood work looks really good, you doubt yourself. Yeah. So that's my biggest struggle.
And the anxiety, did it all start around the time you were diagnosed, or did you have the anxiety even prior to that?
No, the endocrinologist who diagnosed me, she terrified me. She basically said I was going to have AFib and stroke and all of these things. And I was talking to her on the phone saying, but I don't have AFib. Like, I know what AFib is and I don't have AFib. And I said, I'm tired. And at the time I was heavier than I am now. And I was like, none of this makes sense. And she just kept saying, you have to take the methimazole to avoid this catastrophe that could happen to you. And maybe, like I said, I feel like the route I took was the harder route because you have to be really strict with your diet. You have to be really careful, like the bugleweed, and you have to just be really religious about all of it. And it's probably easier to take methimazole, but it's not for me. It didn't seem like a long-term solution. And the fact that you have been in remission since 2000, I can't tell you how much, like, I just run that through my head that you've been in remission since 2009. And that's insane. That's fantastic. So I hang on to that a lot.
All right. Well, thanks for sharing that. And you also mentioned that you had, in addition to anxiety, like you didn't have the classic hyperthyroid symptoms, the heart palpitations, tremors. You actually gain weight, whereas I lost a good amount of weight. And some people with hyperthyroidism do gain weight for numerous reasons. Obviously, you weren't taking the medication. That's one reason. If someone's taking the methimazole, that will usually lead to weight gain. But there could be other factors as well. Just inflammation, imbalances in the gut microbiome could be a factor. Increased toxic burden, cortisol, stress and cortisol, that could be. And that's something as far as some tips, because again, you still have some work to do. You want to not only decrease the anxiety, but get those TSH receptor antibodies, those TRAbs, back to a normal level. Now, hyperthyroidism can cause anxiety, but your levels are currently not, even though your TSH is still low, but your free T4, free T3 are looking good. So maybe that's not the source of the anxiety. Adrenals, you could definitely look at adrenals because you mentioned that there's the stress associated with working with the endocrinologist, and just dealing with Graves by itself is stressful, really any thyroid, autoimmune thyroid condition. So doing an adrenal saliva test to look at the circadian rhythm of cortisol, or maybe, and I talk about these in my books, dried urine testing. The Dutch test is the most well-known dried urine test that also looks at adrenals, but also sex hormones. And then the gut, a lot of anxiety. A lot of people don't think about the gut when it comes to anxiety, but that could be a source. most of the neurotransmitters are actually located in the gut, not in the brain. And that also could play a role in the healing process and normalizing the antibodies. So even if your gut feels fine, I mean, everybody's different. Some people will have bloating, gas, other digestive symptoms. Others won't. Others won't have symptoms and they might have regular bowel movements there. Everything seems fine with the gut, but then they might do a comprehensive stool panel and something actually shows up that could be relevant. Sounds like from a diet perspective, you're doing great. Stress management, you're doing meditation, you're doing a lot of good things. Diet and lifestyle, it seems like you have tuned in. I mean, maybe there's room for improvement, but overall, you're doing a good job. So when someone's already doing a great job with the diet and lifestyle, and you did AIP, like you said, it's not like you have it now, you're doing level 2, but you followed AIP for quite a while too. So that's where maybe considering some testing, just something to think about with like the adrenal testing, maybe the gut testing to see what imbalances you have to get further progress. Hey, this is Dr. Eric. And if you're looking to do everything you can to save your thyroid, in addition to listening to this podcast, there are a few different ways we can help you. First of all, I've written 3 books on thyroid health, 2 related to hyperthyroidism and 1 related to Hashimoto's. And you can get all of them on Amazon, or to learn more about them, visit savemythyroid.com/thyroid books. Second, you can also join my Graves' disease and Hashimoto's healing community by visiting savemythyroid.com/thyroid group. And finally, if you want to get personal help from me, you can visit the website workwithdreric.com. Just to let you know, I only see a limited number of new patients each month, and I do require anyone interested to complete a brief online application before working with me. And now back to the show.
I wondered about the adrenal testing and the gut testing. I did that, I was on your Zoom thing that you did for those 5 days, and you had talked about enzymes quite a bit. And you actually have an enzyme that you sell. And I was wondering, does that help? Would that be something that I should incorporate into my diet, like taking the enzyme plus to see if that I get confused when we start getting deeper to it.
Yeah. The truth is everybody's different. I mean, a lot of people benefit from probiotics and digestive enzymes, and there are people that take either one of them. I mean, it could be a probiotic or it could be a digestive enzyme, and they might notice a really big difference in how they feel digestion wise. Then there are other people who will take these, one or both of them, and be like, you know what, I really don't notice a difference. If you're feeling with digestive enzymes, especially, a lot of people could benefit from them, but especially if someone has a feeling of fullness after eating, if it's like pretty close after eating, a lot of times it's actually low stomach acid, and the enzymes plus has what betaine HCl. If it's a few hours after eating where they have a feeling of fullness, then maybe digestive enzymes. If someone's not having that feeling of fullness, it doesn't mean that they can't benefit from them, but those are like obvious symptoms. Without having those obvious symptoms, the only way to know is to actually give it a try. But a lot of people do have a problem breaking down the proteins that they're eating, as well as, some people, the fats and carbs as well. To answer your question, it could be worth a try. I definitely take supplements, so I'm not afraid to try supplements. And those supplements are more riskier than others, but in most part, digestive enzymes. The only thing is, if you take the enzymes plus, you want to take it with a meal higher in protein, because it does add the betaine HCl. I mean, really, if you're taking a digestive enzyme, even without betaine HCl, ideally you want to take it with food. If you take it away from food, then it's working more as an anti-inflammatory, like proteolytic enzymes. If people take that away from food, they're usually doing that to reduce inflammation. But as far as digestive purposes, if you do try the enzymes plus or something similar, then you would want to take it with food. So yeah, I mean, the functional medicine testing isn't cheap. So before spending a few $100s on a comprehensive stool panel, it certainly would be less expensive to give the digestive enzymes a try and see if you notice any difference. Getting back to the functional medicine testing, I assume it sounds like you haven't done any. I know the endocrinologist isn't going to recommend those functional medicine tests. But
no, I did find a doctor in Sarasota that she actually told me to take this thyroid calm with the bugleweed and the lemon balm all combined. And so she did my blood work. That's where she did the thyroid globulin antibodies. She did all of it because the endocrinologist doesn't do any of that. I didn't even know about it. So I could go back to her and talk to her about adrenal testing and about
the stool test if needed.
Yeah.
Okay. No, that's good that you got that recommendation as far as the thyroid calming. So the bugleweed and motherwort, is it a single formula? Like I know Herb Pharma has thyroid calming formula. I don't know if that's specifically what you're taking.
It's a capsule and I take twice a day.
Oh, I wonder
it's not a liquid.
Like also Thyroid Calm PX. I think I don't know.
That's what it is. So, all right. So I'll go and see her. I wanted to talk to you first and I'll talk to her about adrenal testing and I'll talk to her about everything else. But I think maybe in the meantime, I'll try the Enzyme Plus and see if that makes a difference too.
You never know. Like I said, everybody's different. Some people notice a huge difference with taking supplements. I'm honestly one of those people that if I take something, a lot of times I don't notice a difference, even if it's helping. I can't say that like in the past when I was dealing with Graves. I mean, the bugleweed and motherwort, that I knew because I had the classic symptoms like elevated heart rate and palpitations. So even before doing a blood test, I knew they were working. But a lot of other things, I really don't notice a difference. And sometimes you don't, like vitamin D, you won't know if it's working unless you retest vitamin D. But enzymes, probiotics, anything gut related, if someone especially has gut symptoms, they might notice. In your case, if the anxiety is related to the gut, it may help or may not. It might not be a digestive enzyme problem as far as the reason you have an anxiety. You might need to go deeper. But yeah, I agree as far as maybe trying the Enzymes Plus, see if you notice a difference. If not, definitely consider reaching out. I mean, either way, you might want to consider the functional medicine testing just for that TRAB. My guess is taking the Enzymes Plus isn't going to be the solution for normalizing the antibodies, but maybe it's a piece of the puzzle. And maybe eventually you do some functional medicine testing just to get some more answers, what your triggers are, underlying imbalances, and take it from there.
I listened to your podcast on triggers yesterday. And so, I've been thinking about it a lot because I would like to hopefully be in remission by January 1st. I'm hoping my blood work will be close to normal by then. That's my goal. So I'm hoping I don't hit any roadblocks on the way.
It's a good goal. And as we record this, we're recording this in September. So you have a few months to hit that goal. And again, as long as things are heading in the right direction, obviously your body it's going to heal at its own pace. You could definitely do things to speed it up. But if January comes along and the antibodies are still maybe a little bit high, but better, again, I'm sure you'll still be encouraged and still keep on moving forward. Because, I mean, really, what other options do you have? I mean, getting back to like the endocrinologist, it's not the first time I've heard that an endocrinologist fired the patient, because when you look at, I guess, their perspective, that's just the way they're trained in medical school. There's only a few different treatment options when it comes to these conditions. In the case of hyperthyroidism, Graves, it's antithyroid medication, radioactive iodine, thyroid surgery. And if someone's not going to choose one of those three, then the only reason to see someone is to get the blood test every now and then, but they don't want to order blood tests if someone's taking bugleweed and motherwort, which many are not even familiar with. Definitely can understand getting upset about that, but I wish they had more of an open mind, but most endocrinologists unfortunately don't. And I'm glad that doing it on your own the help of my books too. So I'll take a little bit of the credit, but again, you're the one, books? In all seriousness, obviously you're the one that has cleaned up your diet, managing your stress, taking some of the supplements. And so again, I'm glad that you were able to successfully get your thyroid hormone levels within normal level and optimal level, and a little bit more work needs to be done, but I'm sure you'll accomplish it.
I agree. And I credit your books. I just can't say enough about it, because before I bought your book, I bought another book that said, it was some doctor wrote it about, don't do radioactive iodine. I was like, okay, I'll read this. And he said, take methimazole judiciously, but modify your diet. And so then I thought, well, that's not the answer I was looking for. There's very little out about Graves' disease out there, and it's all horrible. And when I was diagnosed, I had every symptom. Once I was diagnosed, I had heart palpitation. I thought I was going to have thyroid eye disease. Like, I manifest everything. So I had to calm myself down. And I'll say with my blood work, I had it done in June, I think, and my TSH was negative, undetectable. So when I saw it like 2 weeks ago that it was 0.02, I thought, that's huge. That's a huge move from completely undetectable to detectable. I was very excited about that.
I agree. I test for TSH, but I don't get too concerned. It could stay really low. Even depressed, like undetectable for 6 months or longer in some cases. And as long as the thyroid hormone levels continue to decrease and get to an optimal level, eventually the TSH should increase well beyond even what it is now. So yeah, it's always nice, even when it budges a little bit, to see that movement. I agree. And I'm sure over time it'll increase and eventually normalize. And the same thing with the antibodies. It's more, as you know, Graves is more of an immune system condition than a thyroid condition. So ultimately, that's what I focus on more than the TSH, is getting those antibodies normal.
So when you say antibodies, do you mean like the TRAB? Is that the antibody? Like, is that?
Those are, yeah. So with Graves, the TRAB, which are the TSH receptor antibodies, there's also TSI. TSI, thyroid stimulating immunoglobulin, is a type of TRAB. Some doctors will do TRAB, some will do TSI, some will do both. But those are both antibodies. You mentioned thyroid globulin antibodies, and there's also TPO, or thyroid peroxidase antibodies. Yeah. So I don't know if those were elevated too.
No, those are both normal.
Okay,
I had those. She tested those, and they're both normal.
Yeah, those are more closely associated with Hashimoto's, especially those thyroid globulin antibodies. So it's one less thing you have to worry about. So yeah, I would just monitor the Graves antibodies, which again are the TRAB, or again the TSI, or those.
Should I have her do a TSI next time? Because I don't think she did the TSI. She just did the TRAB.
Yeah, I like TSI because it's more specific. Okay. There's a couple of different types of TSH receptor antibodies. There's like a binding antibody too. But usually if someone has hyperthyroidism in the presence of the elevated TRAB, that's pretty much diagnostic of Graves. But yeah, I prefer TSI. The only challenge is you can't really compare the TSI to the TRAB. So when you do the TSI, whatever number it is, you won't be able to say, oh, things are heading in the right direction. It'll kind of be that new baseline. So you might want to, if she's willing to do both of those, so you could see if the TRAB is decreasing, and then get at that time a baseline of the TSI, and then maybe the test after that, just stick with the TSI.
Okay, I can do that. Yeah, I can do that. So I don't need to worry about hypothyroid. Like I saw on the Facebook page, the Graves' disease, our page, a lot of people go from hyper to hypo, but that's not something I need to be anxious about.
In your case, I would say it's not as likely because you don't have those Hashimoto's antibodies. So usually when someone, unless if someone has what's called subacute thyroiditis, which is not the same as Graves, but if someone has antibodies for both Graves and Hashimoto's, again, if they have those TPO or thyroid peroxidase antibodies and or the thyroid globulin antibodies along with the Graves antibodies, then there is a better chance of them becoming hypo. So because you don't have those antibodies, I would say it's a lot less likely that you become hypothyroid. So I wouldn't worry about that. Again, I would just keep up the good work with the diet, doing a great job with the diet, the stress management, try the Enzymes Plus, that's fine. But like I said, I think eventually maybe look into doing the adrenal testing, the comprehensive stool test. And then I don't know for sure if you'll find answers, but that's the goal of doing the test. Good chance you'll find some answers by doing the testing. And then by working with someone like the practitioner maybe in Sarasota, things should head in the right direction. And definitely keep me posted. I'll have other future events that you mentioned. You attended one of my past 5-day live events that I had. So every now and then I'll have those. So feel free to keep me updated, Paula. And thank you again. Yeah, thank you again for doing this audit and for again reading my books. I really do appreciate it.
Oh, well, thank you for writing your books because they really made a huge difference in my life. So thank you.
You are welcome. Thanks everyone for listening. Hope you found this audit to be valuable. And as usual, I look forward to catching everyone in the next episode.
Thank you for listening to the Save My Thyroid podcast. If you haven't done so already, make sure you hit subscribe to stay up to date on the latest thyroid health-related topics. And to get your free thyroid and immune health restoration action points checklist, visit SaveMyThyroidChecklist.com. Thanks so much for tuning in.
So that was a wonderful conversation with Paula. Really enjoy doing these Save My Thyroid health audits. It's great to connect with people who have been following me for a while, who find me through the podcast, who have read my books. So again, this was yet another good conversation. So Paula was fired by her endocrinologist, and this does happen. I do see this. It's actually common when someone isn't completely following the recommendations of the endocrinologist, especially more so with people with hyperthyroidism and Graves when they don't take the anti-thyroid medication. And then essentially they're just seeing the endocrinologist to get their blood test. And some endocrinologists will put up with it, but some won't. And I understand both perspectives, obviously, because I didn't take methimazole, but I understand the endocrinologist. If the person's not following their recommendations and just going there for blood tests, then I understand them dismissing patients. I mean, at the very least, they should give a warning, and usually they do. So again, she was released by her endocrinologist. She was successful in avoiding the methimazole by taking bugleweed. And I think I already forgot. I think maybe motherwort too. But bugleweed is remember, that's the main herb that lowers thyroid hormones. So like when I dealt with Graves, I took bugleweed for its anti-thyroid properties. And I ended up adding motherwort, but it was for the cardiac symptoms, the palpitations. And so motherwort doesn't have a direct effect on thyroid health. Diet-wise, so I believe she said she was following, or she did follow a level 2 diet, which I talk about in my book, The Hyperthyroid Healing Diet, which is similar to a paleo diet, kind of like a modified paleo diet. And then she was discussing how her T3 and T4 were within range, but her TSH was still depressed, which is very common. I actually have an episode talking about this, like how long does it take for the TSH to increase? And the reason I have this episode is because it could take a while for the TSH to increase. And it sounded like it did budge a little bit. It was no longer completely undetectable, but in some cases, it'll remain completely undetectable for months, sometimes like 6 months or longer. And then the TRAB, TSH receptor antibodies, was still elevated. So really can't conclude that someone is in remission until, and in my opinion, I mean, I was going to say until the antibodies are normal, but even with the thyroid, if she's still taking a bugleweed, and again, her TSH, T3, T4 more important than a TSH, but TSH is still important. So ideally, we want to see not only the antibodies normalize, but of course, we want to see her thyroid and her TSH looking good without the bugleweed. It's great that she's able to avoid taking the anti-thyroid medication because not everybody is able to do this. Some people, the herbs just aren't working, but it's good that she is able to successfully manage her hyperthyroidism with the bugleweed. So also, Paula mentioned how she gained weight since being diagnosed with Graves' disease. A lot of people lose weight. Many people listeners know that I lost a lot of weight. I lost 42 pounds when I dealt with Graves. And weight loss is the more classic symptom associated with hyperthyroidism just because of increased metabolism. But for different reasons, some people gain weight. And I've had a few podcast episodes where I discuss this. Anxiety also is something she's experienced. Anxiety, very common with Graves, but in her case, or common with hyperthyroidism, just because of the elevated thyroid hormone level. So even in this person that has toxic multinodular goiter, without that autoimmune component, they might still experience anxiety. But in Paula's case, since the thyroid hormone levels were looking good, maybe this wasn't responsible. Now, I didn't look at the lab, so I don't know. Maybe they were on the higher side, but still within the lab range. So they might have been outside the optimal range. Maybe they were within the optimal range, but there were other factors. So gut health is something that's very important. Most of the neurotransmitters located in the gut. She has been doing meditation, some breathing exercises. And recently I did an interview with someone whose interview actually won't be posted until I believe after this health audit. So it might be a couple of weeks. She spoke about a device called the Nucom that could help with anxiety, also help with sleep. And then digestive enzymes. She asked about my Enzymes Plus supplement, and I mentioned how it's worth giving a try to see if someone's having digestive symptoms and if it's not resolved by changing one's diet, then taking digestive enzymes with the betaine HCl, and that also has the ox bile, it's worth giving it a try. Sometimes, obviously, we need to do other things. If someone has H. pylori or parasites or SIBO or something else going on, then digestive enzymes probably won't make a big difference. But I've had people where they take a digestive enzyme and it does help with some of their digestive symptoms, similar with a probiotic. There's many people who take a probiotic and it helps. And then there's also a lot of people who take a probiotic and they're experiencing digestive symptoms and it doesn't help. And sometimes it could actually make things worse depending on the situation. Most of the time not, but if someone has SIBO, usually the prebiotics make it worse, but sometimes those probiotics can also make it worse. And so I think that's all I wanted to chat about here. Again, really enjoyed my conversation with Paula. I'm glad that she's able to avoid the methimazole and still, again, has some improvement in her antibodies as well as her TSH. But again, it sounds like she'll get there. She's determined to restore her health. And this interview was a few months ago. So I've had a good demand for these health audits. So by the time this is released, which should be March of 2025, she might actually be in remission possibly, or maybe at least hopefully TSH receptor antibodies continuing to head in the right direction, as well as the TSH. So as usual, I hope you found this conversation to be valuable and look forward to catching you in the next episode.